Hello, hi, this is Dr. Marcovici from Aesthetic Medical Center in Myrtle Beach. Today we're going to do a treatment for hair restoration and regeneration, which is based on PRP or Platelet Rich Plasma for our patient, which we'll call her today Elizabeth. This is her fourth treatment, and today she's going to finish her protocol. The treatments are once every month for 4 months, and today is the last treatment she's going to have. The idea of regenerating the hair with PRP is based on regenerative medicine. The PRP is rich in the growth factors, and when they're injected in the scalp, they wake up the follicles which are dormant or trigger the formation of new hair follicles from the stem cells which are there on the dermis, and we expect probably about 30 to 40% increase in hair density after the fourth treatment. So I will ask Elizabeth today how she feels so far, and why did she decide to have the procedure, and obviously if she is for the fourth treatment, I assume she was very happy with the results so far.
Yes, very happy with the results. I can see some new growth coming.
Oh, wonderful. So this treatment is basically tailored for people who have thinning hair or start to have loss of hair. And PRP is basically, as I said, plasma-rich platelets. And for this, first we numb the scalp with a cream. We wait about 30 minutes. In the meantime, we're drawing some blood and we're spinning the blood. And then we're going to have the clear plasma with PRP is in these syringes, which we're going to inject in the scalp. So first of all, we're going to sanitize the area which we're going to treat with alcohol, and then we're going to do the procedure itself. And we'll start with areas here close to the temple. And Elizabeth, if you want to turn the head like this, and we're going to how you're doing?
I'm doing okay.
Any discomfort, any pain?
No pain.
So far so good?
So far so good.
Alright, so now that we're done, how you'll summarize your experience, Miss Elizabeth?
It was definitely a short treatment, and you felt a little bit of pressure, a little bit of prick from the needles, but all in all, it was tolerable.
Yeah.
Very tolerable. Yes.
Would you recommend to other people?
Oh, absolutely.
When
if you
you
have
see-
hair loss or
Yeah.
and you need hair restoration, I would absolutely recommend it.
Oh, wonderful.
Mm-hmm.
Alright, so we'll see you back in about 6 months to see how you're doing, and if
Sounds
you'll need
great.
some extra help, then we might do one treatment for maintenance, 6 months, once a year, whatever is good. Alright,
I'm up for it. Thank
good
you.
luck. Sure.
Thank you.